So how come you're hearing the adjustments a lot more, maybe up here in the neck area, but you're not hearing it quite as much in the mid back or in your low back, right? Well, that's because in the neck, our ears are so close to these bones that we're moving. We got a lot of range of motion, and when we twist them and we turn them, it's possible that it's gonna have a pop, and that's right near the ear, and so that's gonna make it a lot louder. Now in the chest, you're gonna hear it as well too, because our lung cavities are there. And the lung cavities are gonna actually echo the sound, and you're gonna hear it possibly even more into your ears. But in the low back, we got a lot going on down there. We got our guts, we got muscles. Some of us got a little bit more going on down there in the belly as well too, so that muffles the sound. And then especially if we're using the drops on the table, that's always gonna end up muffling the sound too.